Yeah, I think there are do's and don'ts about what to do before surgery if you have a rotator cuff tear. You know, one of the things that's common is that people are getting cortisone injections to help their pain. In general, if you know you have a rotator cuff tear, it's probably better to not do cortisone injections because it can weaken the tendon. And that can make it tear into a bigger tear, or it can make it more likely that your repair doesn't hold up. So once it's known that you need surgery, I would hold off on injections, at least steroid type injections. There are other type injections like Toradol that is an anti-inflammatory medicine that you could do to buy time. Another thing that's really common is you get into this cycle of pain leading to decreased use, leading to stiffness. And that you can loop in that cycle a little bit and get stiffer and stiffer because you're not using your arm. And so if you don't want to go into rotator cuff surgery being stiff. So most surgeons will try to look at that, and if a patient is a bit stiff, then pre-operatively they'll put them on a home program or maybe even physical therapy to try to restore good rotational arc of motion so that when you do go in and repair the rotator cuff, you don't wind up having a stiff shoulder. That's probably one of the worst complications or more difficult things to deal with after having your rotator cuff repaired is if your shoulder gets too stiff. So you don't want to go into it stiff.